Today, we will discuss an important yet often overlooked issue: high diastolic blood pressure. Many people focus only on systolic blood pressure, but elevated diastolic pressure can be just as dangerous. It affects blood vessel health, heart function, and even brain activity. In this video, we will explore why diastolic pressure rises, what causes it, and what you can do about it. What is diastolic pressure and why is it important? When we measure blood pressure, we see two numbers. For example, 130 over 80 millimeters of mercury. The first number, 130, represents systolic pressure, which indicates the force with which the heart pumps blood into the arteries. The second number, 80, represents diastolic pressure, which reflects the pressure exerted by the blood on the artery walls when the heart is at rest between beats. If diastolic pressure consistently exceeds 90 millimeters of mercury, it is a cause for concern. Elevated diastolic pressure means that blood vessels remain constantly tense, making it harder for blood to flow. This can lead to oxygen deprivation in vital organs, impairing brain and heart function. Additionally, prolonged high diastolic pressure increases stress on the vascular system, raising the risk of cardiovascular diseases such as stroke and heart attack. Main causes of high diastolic pressure: narrowing and loss of vessel elasticity. Over time, arteries lose elasticity due to atherosclerosis, chronic stress, smoking, and poor diet. Atherosclerotic plaques narrow blood vessels, restricting circulation. As a result, the heart must work harder to push blood through, increasing diastolic pressure. Kidney problems. The kidneys play a key role in blood pressure regulation by managing blood volume and fluid balance. Conditions such as chronic glomerulonephritis, renal artery stenosis, or diabetic angiopathy can cause fluid retention and increased pressure on blood vessel walls, leading to high diastolic pressure. Cervical osteochondrosis and chronic neck muscle spasms. Tense neck muscles can compress blood vessels, reducing brain circulation and increasing strain on the cardiovascular system. This can contribute to vascular tone abnormalities and elevated diastolic pressure. Hormonal imbalances. Disorders of the thyroid gland, hypothyroidism, adrenal glands, or pituitary gland can lead to hormonal imbalances affecting vascular tone and blood pressure levels. For example, elevated cortisol levels cause fluid and sodium retention, which can raise blood pressure. Sedentary lifestyle. Lack of physical activity weakens blood vessel tone, impairs circulation, and contributes to high diastolic pressure. Prolonged sitting slows metabolism and worsens cardiovascular function, potentially leading to blood stagnation in the vessels. Excess salt in the diet. High salt intake promotes fluid retention in the body, increasing blood volume and pressure on arterial walls. Alcohol and smoking. Alcohol and nicotine damage blood vessels, causing them to constrict and lose elasticity. This increases vascular resistance, keeping diastolic pressure consistently high. Symptoms of high diastolic pressure. Headaches, especially in the back of the head, due to impaired circulation. A feeling of pressure in the head, ringing or buzzing in the ears caused by disrupted blood flow to the brain. Dizziness, brain fog, and reduced concentration. Shortness of breath, possibly due to increased heart strain. Rapid heartbeat as the body compensates for high blood pressure. Sharp or aching chest pain due to added stress on the heart muscle. Swelling in the legs indicating fluid retention in the body. How to normalize diastolic pressure? Physical activity. Walking for at least 30 to 40 minutes a day improves circulation and strengthens blood vessels. Swimming, yoga, and Nordic walking help relieve muscle spasms and improve overall health. Neck and back exercises relax muscles, reduce strain on blood vessels, and help normalize blood pressure. Dietary adjustments. Limiting salt intake to 3 to 5 grams per day reduces fluid retention and heart strain. Increasing consumption of vegetables, fruits, and whole grains strengthens blood vessels. Eating potassium and magnesium-rich foods, bananas, nuts, spinach, buckwheat, helps regulate blood pressure naturally. Eliminating bad habits. Completely quitting smoking reduces strain on blood vessels and improves their elasticity. Minimizing alcohol intake prevents sudden blood pressure spikes. Managing stress. Meditation and breathing exercises lower cortisol levels and stabilize blood pressure. Getting enough sleep, 7 to 8 hours, allows the cardiovascular system to recover. Magnesium and B vitamin supplements, after consulting a doctor. Magnesium and B6 deficiency can contribute to high blood pressure, so a supplement regimen may help regulate levels. Home remedies. A warm bath with sea salt relaxes blood vessels and lowers blood pressure. Gentle neck and shoulder massage improves circulation. Onion peel tea, 1 cup before bed, for 2 to 4 weeks, helps strengthen the vascular system. Of course, any treatment should be discussed with a doctor. Self-medication can be dangerous to your health. High diastolic pressure is a warning sign of vascular and circulatory problems. It is essential to adjust your lifestyle, monitor your diet, stay active, and manage stress in a timely manner. If your blood pressure remains elevated, consult a doctor and undergo a medical examination. If you found this video helpful, give it a like, subscribe to the channel, and share your experiences in the comments. Stay healthy.